So there's this really not great time when you finally get your MRI images to download onto your medical app. It's that moment of apprehension you had whenever you would get test scores back in high school. And especially if you're already experiencing back pain, you're wondering if you didn't fail the test. So when you open up that report and you see words like extrusion, sequestration, herniation, thecal sac compression, or stenosis, you really start to panic. And like every panicking patient that's come before you, you go on Google. And who wouldn't freak out when some of those things are saying ruptured, leaking, or something as scary as bone digging into your spinal cord? Because yes, at face value, those conditions are terrifying. But here is one of the things with MRI reports. Your radiologist or your doctor who's writing that report has to write down in stark black and white detail exactly what's going on. And whenever all you're doing is looking up those foreign words that look like they came out of some alien sci-fi book, you're typically painting yourself a worse image than what you actually have going on. But the unfortunate thing that I've come to notice at the office is that for whatever reason, most doctors, at least around me, never go through that report with you to explain what any of those words mean. That's why today I want to go over some of the vocabulary with you. One, so that you have a better idea of what's going on in your body, and two, and more importantly, so that you're more informed on what are the appropriate steps moving forward for you to take the best care of it. But if, let's just say, you've already been diagnosed as having a cervical disc herniation and would rather go through a conservative approach to treatment, go on down into the description below this video and download the free tutorial for the Cervical Disc Recovery Blueprint. It's the entire first part of the module where I'd walk you through exactly what to do day one after an injury. In that free module, we'll be making sure that your disc herniation isn't anything worse that you need to be more concerned about, but we'll also be showing you exercises and stretches which will help to alleviate nerve pain down into the arm and help with neck stability so that you get out of pain faster. And since you've already been diagnosed as having a cervical disc herniation, that means that you fall somewhere on what I like to call the jelly donut spectrum. And what the jelly donut spectrum is probably the best visual representation that any medical professional can give you when it comes to your cervical discs. Because your discs are made out of a hard outer material and then a soft, squishy inner material. And whenever you have a disc herniation, what happens is that outer shell fails and that squishy inside either bulges out or squirts everywhere. Which leads us to the jelly donut spectrum. How squished is that jelly donut? Is it just a bulge, in which case the disc has been compressed and swollen, but it hasn't broken down at all? Or do we have something a little more intense, like a protrusion? Now, a protrusion is when a small part of that jelly donut starts to push out of a crack in that hard outer wall, the annulus fibrosus, but it stays contained. Think of it kind of like if you've ever had a water balloon when you squeezed it really hard, but it didn't pop, it just kind of ballooned out at another section. That is a disc protrusion. We have a tiny focal point of pressure, but nothing has squirted out. When it does squirt out, that is when it is called an extrusion. And this can be thought of as you're squeezing that water balloon or you're crushing that jelly donut, and we get a crack where all of the jelly filling starts to seep out. And in the case of your spine, it starts to leak on your spinal cord. And then finally, we have a sequestration, which is a weird one. It's where part of that jelly filling breaks off and is just free floating out in the spinal cord. But the entire nucleus pulposus, the squishy part on the inside of your disc, isn't leaking out. Take a second and think about this. Out of all those four, which one sounds the scariest to you? And honestly, even being in this profession for about 7 years, I still think disc extrusions sound the scariest. To have the entire inside of your disc rupture and then squirt all over your spinal cord. But ironically enough, these are actually the most common injuries that can heal up on their own. Because once the contents of that inner disc are out and about your spine, your body's immune system, the cytokines and the macrophages, can begin breaking it down and reabsorbing it into the body so that you can get rid of it. But Whenever it's something like a bulge that's self-contained, discs already have terrible blood supply, so the time it takes for your immune system to actually recover from a disc bulge can be months, sometimes even years. But then what should you do if you are diagnosed as having an extrusion? What if your surgeon is telling you that you need to have it operated on or have your spine fused? Now look, I'm not your chiropractor, I don't even know you, but what I do want to make sure of is that you understand your options. Yes, disc herniations are awful. When I experienced mine, frankly, I would rather have a broken bone than a herniated disc any day. So wanting to get out of pain quick only makes sense. But here is the thing with surgical interventions. You're going to wait a couple of weeks before you have the surgery. You're going to have an irreversible procedure done. You're then going to spend 6 to 8 weeks recovering from that surgery, and then you're going to go to physical therapy. Versus if you go get a second opinion from a chiropractor or a physical therapist near you, you might as well just start physical therapy now and see if you don't get results in the first week. Because even if you don't, you still have surgery scheduled in another 2 weeks. But what if your MRI report doesn't just mention disc conditions? What if it's also talking about stenosis or compression? What does that even mean, and do you need to worry? Stenosis is just a fancy word for saying calcium deposits or bone calluses. But more specifically, stenosis occurs whenever those bone calluses are forming in a hole, making that opening more narrow. In the case of central canal stenosis, that is whenever this opening is narrowing and is putting pressure on your central nervous system, your spinal cord. Now, if it says IVF stenosis, that is going to be referring to this hole where this little squiggly guy comes out of. And whenever that bone starts to narrow this opening, then you're going to get more secluded symptoms because we're only affecting one nerve instead of your entire spinal cord. In either case, if your MRI has either stenosis or a disc bulge mentioned somewhere on there that is compressing a nerve, that is a surgical emergency. Not life and death needs done right this second, but it is something that is going to need surgical intervention. But if it is just saying it's mild or moderate, then you don't need to panic because you have time to fix it before it gets to the point where that stenosis or that bulge might be compressing a nerve. And that's because stenosis often occurs whenever there's instability in a joint, and that joint isn't moving properly, so your body lays down calcium deposits to make sure it doesn't move too much. And we can fix this, or at least slow down the progression of this calcium deposit, if we stabilize your neck using strengthening techniques, such as isometrics and micro movements. And again, if you would like to learn those, just follow that free link down in the description. But then, what are you going to do about this bulge? What are you going to do about the stenosis? The surgeon makes it sound like you're 3 steps away from being paralyzed for the rest of your life. And if you don't get those spinal segments fused, you're really running the risk of permanent damage. But is that always the case? In all honesty, I feel like most surgeons are trying to do their best to lead you in the right direction. They look at your MRI, they see some herniated discs or some stenosis, and their best remedy is to operate. But one of the things that I feel surgeons forget, as well as medical doctors, chiropractors, and physical therapists, is that what you see on an MRI doesn't necessarily reflect symptoms. Because a dirty little secret that all of us learn in school is that MRIs don't necessarily show the full picture. I've personally had patients either with MRI or X-ray findings where everything looks like a bomb went off, but they're totally fine. None of their problem is actually corresponding to the horror show that is going on their imaging. And then simultaneously, you'll have people go out, get imaging, and there's nothing wrong with what's on the X-ray or the MRI, but they're in severe pain. And this is annoying, but at the same time, we need to remember that an MRI and an X-ray are just diagnostic tools. They're never going to be able to give us the full picture. And personally, while I do like MRIs, and they do show swelling and they will show irritation in the form of swelling, they have a hard time showing us stability. Because if you have instability in a joint when it's moving, or even as your body's holding you still, your body is going to send you a pain signal because it senses that joint isn't secure. And rather than running the risk of having you move your head and injuring yourself further, your body sends that pain signal to keep you in place and to make sure that you don't do anything stupid that would turn you into a position where you would risk injuring that joint further. With that in mind, whenever you see that there is a disc bulge or a herniation, and then the surgeon is thinking that is the cause of your pain at that level, it might be true, but it might also be true that after removing that disc or after fusing those two segments together, we still have pain, because while we treated the picture, we didn't treat the patient. We didn't fix that instability, and despite there now being a piece of hardware in there or a disc removed, we still have a muscle that's not firing properly. When it comes to your own recovery, there are a few questions you want to ask yourself. Are you willing to wait and give your body a chance to heal itself? Because if you are, go a conservative route first while you're waiting for that surgery. If they give you a date a month from now, undergo PT or chiropractic care for that month to make sure that you don't recover by giving your body the time it needs to heal naturally. Because remember, after a surgery, you're still going to need to go to PT, your body's still going to need to heal for 4 to 8 weeks anyway, so why not give it a try without the surgery? Additionally, you can always consider alkalizing minerals to help decrease inflammation from a sequestered disc. And you can couple that with proteolytic enzymes, which are digestive enzymes your body uses naturally to break up protein sources that shouldn't be there. Damaged tissue, broken tendons, things of that nature. If you want, you can follow the link below. It's to Designs for Health, and they're the people that I use whenever Holly and I need vitamins. Finally, in the case of stenosis, mobility and stability are your biggest friends when it comes to calcification of ligaments or the formation of bone spurs. So, either going to a physical therapist, a chiropractor, or check out that free module down in the description, because in there we are going to be showing you tips and tricks for how to get your deep cervical flexors to start to activate again, which will greatly enhance the stability of your neck segments. And with any of those options, really the only thing you have to lose is a pain in your neck. And with that, guys, I'm Dr. Beck. Thank you so much for watching. I hope this video helped to answer some of your questions about a disc herniation, a bulge, an extrusion, and what's the best course of action for you given each scenario. If you found this information useful, please leave it a like so other people like you can find this video as well. If you have any questions, feel free to leave them down in the comments section or check out the rest of the YouTube channel, in which case I will see you in the next video.